Those recommendations will be coming out from the CDC. They're being evaluated on a daily basis. Right now, the recommendation is as I just prescribed. Go about your normal daily activities if you are healthy. If you are not healthy, think very seriously about attending places where there are crowds.
Dr. Carson, thanks for your time this morning.
My pleasure.
Let's get more on this now from our Chief Medical Correspondent, Dr. Jen Ashton, and former Homeland Security Advisor, ABC News contributor Tom Bossert. And Tom, let me start with you. When you were working in the White House as Homeland Security Advisor, you also were part of this whole effort to have bio preparedness. What do you make of what we just heard from Dr. Carson, also more broadly, what people should expect about the magnitude of this crisis?
Yeah, there's a difficult inflection point that we've reached, and I think the president deserves credit for the first one. They acted quickly to contain this, but they bought us time, and now we're at a second inflection point. And I'll be honest, I'm very disappointed to hear the message I just heard, because it's not about individual prevention. That's important, and the doctor will tell you that. But as a collective public, we need to start mobilizing this collective risk mentality. People not getting sick have to do with arresting the spread of this disease. This virus is demonstrating a potential that is way more significant than the flu. And so when I hear people say that we're dealing with the flu or something like it, I get awfully nervous, because the numbers suggest that this, if we don't act to intervene and interact with this disease in a way that's collectively aggressive, this disease spreads 3 times more quickly among a populace that doesn't have any immunities to this virus.
So
and it can kill 10 times more than the flu.
That estimate I said at the top of the program, that potentially 100 million people, that's not outlandish?
Well, what we want to do is make sure that we don't make a prediction. But the potential for this virus has demonstrated that it can have a 30% attack rate. And if you apply that to the U.S. population, that would be 100 million people infected, but not sick. Now, that's a terrifying number, but we've seen in Singapore and Hong Kong that we can intervene and we can change that outcome. So it's not a prediction, but that potential is dangerous, and it's important to understand it.
Dr. Jen, like Dr. Carson, you're a doctor.
Yeah.
What'd you make of what you heard?
I think the point, to echo a little bit of what Tom said, is that we have to stop thinking just about how you can protect yourself and how I can protect myself. The fact of the matter is, when you talk about aggressive social distancing measures like school closings, it's not because we're just trying to protect children. They're relatively spared, as we know at this point, about coronavirus. It's so that those kids don't go home to their 85-year-old grandparents, the vulnerable population, and infect them. So that's why we have to broaden out in a ripple effect. And as usual, unfortunately, and we see this all the time, there seems to be a big disconnect between what we're seeing at the top of the pyramid and what's really going on clinically in the trenches with patients, nurses, doctors in hospital ERs, doctors' offices, urgent care centers, and there is a lot of confusion, concern, and chaos.
And there also seems to be a lag time in some of the administration responses. Tom pointed out the administration moved quickly on that travel ban, but we just heard from Dr. Carson, the cruise ship gets into port in Oakland tomorrow. They're still formulating the plan.
Yeah, here's the thing about that, George. And the cruise ship, as we heard with the Diamond Princess, and now we're hearing with the Grand Princess, in medicine, we have to get up to speed quickly, and the clock is ticking, so time matters. If left unchecked, this is a virus that suggests, based on the transmission dynamics, that it doubles roughly every 7 days. It's not that difficult. Test every single person on board. Those who are completely asymptomatic get put into quarantine, which is how we observe people who have been exposed to an infectious disease. Those who have mild symptoms get isolated. Isolation is for people who have mild symptoms. And those who have severe symptoms, and there are over 1,000 people over the age of 70 on that ship, need hospital care. Off the ship. It's not acceptable to say, well, we've seen this before, we know how it turns out, but yet we're not going to get them off the ship until Monday.
And Tom, what broader community measures should we be considering?
Yeah, George, think about that. As people think about whether they would go on a cruise ship right now, think about how you'll feel in a few weeks about going into a dorm room or some other place where there's communal food, communal housing. It looks a lot like a cruise ship, just stationary. And so we need to think about this as a means of time and planning right now. So I suppose I would give maybe 2 big messages. It's not so much that the administration is not prepared or that they haven't done the right thing. That's not accurate. We now have an inflection point. We're moving forward. We have to message this properly to empower the state and local officials who are going to make these decisions, to make them with confidence. Because If they think their populace won't follow their advice because this doesn't seem like a big event, it doesn't seem like a big disease. You know, somebody told me it's like looking at a star. The light that you see left that star in the past. You're not seeing what the star looks like today. And because of that lag that you referenced, we're going to have to make decisions at state and local levels, at corporate levels, before it appears to the public that it's necessary to do so. But I assure you it's necessary to do so early. That's the message, and it won't be a federal responsibility. It'll be a joint and shared and decentralized one.
And George, I also think it's important to remember that when we hear numbers, it's not just a case count. These numbers represent people. And so it's important to, when you're communicating health and medical information, to understand that anxiety is higher, people are concerned, people are afraid, and when you hear politicians or government officials say, don't panic, it can run the risk of being dismissive or insulting and actually can create panic. So I think we need to act here based on evidence and not emotion.
Important reminders from both of you. Thanks very much. When we come back, it's now a two-man race for the Democratic nomination. Can Bernie Sanders come back after Joe Biden's Super Tuesday surprise? Make several looks at the odds, and the senator joins us next.